Okay, good morning, everyone. For those of you I have not had the opportunity to meet, I am Mary Taylor, the Senior Vice President for Operations and Finance. So thank you for coming to the monthly update. I'm going to start today, and then I will turn it over to Dr. Langell, who will then turn it over to the next presentation. So at the town hall meetings that we held, Dr. Faze and Dr. Langell and I with staff, one of the suggestions that came up was the idea of a suggestion box so that faculty or staff and even students can submit questions or ideas about how to make our campus a better place. So because of that, we did create an electronic suggestion box. And I want to thank Jonathan for putting that together for us. So if you go to the internet, go to the staff faculty page, it's at the bottom. So if you have any ideas that you would like to submit to us, we do welcome your feedback. You can submit anonymously, or if you would like additional follow-up, you can put your name there and we'll follow up. Most of the submissions to date have been anonymous. We've had 23 submissions since the suggestion box went live. And so what we promised at the beginning is that we would close the feedback loop and that we would actually share with you the suggestions that have been provided and also any action that we have taken because of the things that you have submitted to us. So I'm basically just going to go through the list. I'm not going to read each of them to you. I'll kind of summarize what the comment was, and then I'll tell you what action we've taken. All the items, the suggestion box submissions do come to me. And I look at every single one of them, and then depending on the nature of the comment, question, or request, I'll send it to somebody else to potentially help me address it. So for example, we had two submissions from students specifically with regard to the curriculum, and I forward those to the deans, so the deans can address those in their next town hall or next meeting or discussion with their students. So for those of you that have helped me respond to these, I just want to say thank you. So let me just get started. The very first item we received, and we've had a couple of comments or concerns with regard to the cleanliness of the Great Hall, the training room, Michelle and Olson. It's important to know, so that's kind of on the NEOMED campus side versus this side of the new center, which is our public side. I've had several conversations with Dale Haluk, who is our Executive Director of Campus Operations, and he is reporting to me that we are not very happy with the janitorial service. So I appreciate the comments that we received. I'm assuming they came from students, but we hear you, and we are working on that issue. Dale has had several conversations with the janitorial company that takes care of the campus side. It's a different company that takes care of the new center public-facing side. We are pleased with the company that does that, but we are not happy with the cleanliness of the facilities on the campus side. So Dale is working on that, and obviously we do expect our vendor to adhere to the contract and to perform as we would expect. And if we have to do something different in the future, we definitely will do that. So thank you to whoever reached out to let us know that there are some issues with regard to the cleanliness. We also received two comments with regard to the student gaming room and the ping pong table. The noise that is coming out of the room when the students are obviously in the gaming room enjoying themselves. You know, we built this space for our students. We wanted to give them the opportunity to release their stress and enjoy a little bit of time with their friends and their classmates in a way that's not stressful, away from their curriculum. So we know it's an important space for our students, but we also do understand in some cases it's a little bit disruptive. So we continue to look for ways that we can address those noise issues. Again, we had two people that submitted comments with regard to that. So we haven't been able to actually address it just yet, but we are continuing to look for alternatives. Also, two comments with regard to the bathrooms, the older bathrooms in the older buildings on campus. We obviously know that the bathrooms are old. They look old when you go in them. We are careful that we want them to be clean, but they are old. And as we have continued to kind of march through campus, modernizing new paint, new carpet, new chairs in conference rooms, for example, new technology in our conference rooms. The bathrooms are on our list of the future renovations that we are expecting. A part of our 2030 strategic plan calls on us to put a plan in place to continue to modernize our campus, and those older bathrooms will be on that list. They are expensive, And as you know, we have finite resources, so we have to evaluate and make decisions about priorities, obviously looking to address student-facing areas of campus first, and then we'll continue to work through the rest of that. We did get one comment with regard to compensation and how we post and offer positions. Again, I'm not going to read the entire submission, but that was basically the summary, not really understanding how we handle compensation when it comes to posting positions. So we essentially do post vacant positions or new positions that have been approved in the zero-based budget process in the first third of the pay grade. The question came up, do we do that? Yes, generally we post them in the first third of the pay grade. Generally, we hire within the first third of the pay grade, but we have to obviously know what a position has been budgeted. We have to stay within the budget. And essentially, the reason that we're doing that is we understand that you have a position that's vacant, and maybe it's vacant because the incumbent left. And basically, looking for the skills that are necessary to do the job based on the job description. There are cases where we have offered positions outside of the first third of the pay grade, but those have been in extenuating circumstances, and it is based on the level of education and experience that the individual is bringing, that you or your committee has recommended you make the job offer to. I can tell you, Jenna in HR does a great job. She is very thoughtful. She has a pretty voluminous process when she looks at, evaluates not only job descriptions and pay grades, but also when she's looking at the compensation that she's going to recommend to a hiring manager after they've gone through their hiring process and identified the candidate that they would like to offer the job to. I know compensation's always, we always get questions about compensation, and I hope that we want to be as transparent as we can be in trying to help you understand. We want to communicate how compensation is determined. I know hiring managers care very deeply for the people that work for them and for the individuals that they're offering positions to. And I appreciate that you oftentimes want to offer more than maybe the education or the experience of the individual warrants. And I appreciate the opportunity to work with each of you on sometimes, they're difficult conversations, but we are a public entity. We are accountable to the state, to the taxpayers, most important to our students who pay tuition and fees, and we want to be mindful of what it actually takes to get the job done. So it's always a tough conversation related to compensation, and I will continue to be as open and transparent as we can be, and as you have additional questions, we will continue to answer those. We do at NEOMED strive to pay a competitive salary. I hope that you know over the last 5 years, our pay raises have outpaced that of the other public universities in Ohio. People was one of the pillars of our last strategic plan. We do know that our people are the most important asset that we have. You are who interacts with our students every day, that helps us ensure they have an excellent, exceptional student experience here at NEOMED. If I can turn my page, I'll get to the next one. Not that easy. Okay, so the next one. I have to say this is your favorite, Dr. Langell. And I wanted to bring the entirety of it so that I could read it because it was quite fun reading. So one of the things that I will say bothers some of us as we walk around campus is that we have all of these folding tables that are not very pretty, and oftentimes are leaning up against walls or set against walls, dinging the paint that was just put on the wall. So one of the things, and actually that's the next comment, and it was really fun to read, but basically the comment was, could we have standards for tabling and furniture management? The hallways look littered. The 6-foot tables are ugly. We all appreciate our campus and we want it to look as good as possible. And so in an effort to try to make our campus kind of streamlined and make it clean, we've ordered those, and there's 2 of the tables. There were 2 not uncovered. 2 of the tables out there have the black tablecloths or table covers. that are NEOMED branded. So we ordered those. We would like for them, to the extent that those tables need to be in the hallways, we would like for them to be covered so that we have a campus we can all be proud of. If those tables are not being used, we have asked time and again for them to please be stored and to be very careful that they don't get set up against the walls. I mean, Dale's team does a great job painting, and oftentimes he's in the hallways covering up nicks. So if you're responsible for those tables, we hope that you will put them away when you're not using them. And when they are in the hallways, we would like for them to be covered. Again, it's part of what we are and who we are as an institution. I did get a specific comment. It said continue town halls and university updates for transparent communications to build trust in the campus community. And I appreciate that comment, and that is exactly what we're trying to do. We're trying to be open and transparent in our communication. And that's why Dr. Langell every month does a monthly update. And as I said, I will continue to close the feedback loop on the suggestion box items. We did have somebody comment and request that we do bring your child to work. We bring that back to campus. It ended as a result of COVID, and we haven't had it since. And honestly, that was pre-me, so I didn't even know that we ever had that on campus. So I've had conversations with Laura and HR, and for those that were here when you had Bring Your Child to Work Day, it takes a lot of people. It's a lot of work. And we need everybody to be bought into it to make it a great, successful day for our children that I understand it used to be very, very successful. So I know HR is going to be reaching out to many of you to ask if you are going to be willing to participate if we were to do Bring Your Child to Work in April of 26. Oh, so we did also get a specific request that we make a specific and special time for faculty and staff to visit and tour the Batonti College of Dentistry. So I reached out to our new dean and I said, this was a suggestion box item. Do you think this is something that you would be able to do? And obviously, you know that there was an open house on August 14th. And I know when I was there were many people touring the new facilities, which are fabulous. And we welcome, of course, our first inaugural class for the Batonti College of Dentistry. So if you haven't had a chance to see it, I would encourage you to go over and take a look. I did get a specific request to pay administrative staff twice per month rather than monthly. And also requested to be able to view pay stubs 2 days prior to when their pay actually posts. So I reached out to some folks in accounting and HR and payroll, and essentially we do pay administrative staff monthly. It's kind of a best practice in higher ed and government, so we're kind of within the norm to do it monthly. To do it more often to pay more often than monthly for administrative staff would be, it would be an administrative burden. It would require basically double the work that's being done today. It's not really very efficient. And it maybe would even require us to hire additional staff. So we really don't want to switch to paying administrative staff every 2 weeks. We're going to keep it monthly. However, it may be done. I'm not sure if Ron or anybody, Jonathan maybe knows. I did reach out to IT and payroll and did ask if it was possible to have pay stubs available 2 days before the pay actually posts. And that is possible. And if it hasn't already been turned on in Banner, it will be turned on. This is a very specific question, so hopefully the individual that submitted it is listening. It's called Cigna downcoding. They read an article in a newspaper that was in a different state that was about Cigna doing downcoding with regard to procedures. So Cigna is our network for our health insurance for faculty and staff. That possibly why the question came up. So I reached out to AltCare to get a response to address the question with regard to Cigna downcoding. There is no impact to patients. The Cigna network providers should not balance bill you as a member. So when you go for a procedure, and it's an in-network provider, they should bill you what their agreement with Cigna is. So you should see no additional charge, nor should there be any impact to you as an employee who's participating in the health insurance here at NEOMED. The carrier was unable to determine the impact to students because that was also specifically asked once they enter the field of practice. And this, I'm just reading now verbatim what I heard back from AltCare. As Cigna continues to evaluate their fee allowance models, providers may work directly with their Cigna contracting representative to address concerns and review their appeals rights. Again, this will not impact current participants in the NEOMED healthcare plan. My guess is that's a longer conversation to actually understand fully the question that was being asked, but that's basically what was put in the suggestion box. And then again, that's AltCare's response. And then the last item is it was requested that we replace the Campbell atrium signage, meaning that put it back up. And Dale and I talked on Friday, and it's probably not done yet, but yes, we will in fact be putting that Campbell atrium signage back up. So that's it. Those were the suggestion box items that I've received to date. And again, as I accumulate these, I will bring them forward to you so that we can close the feedback loop. Thank you. Dr. Langell.
Thank you. Oh, I don't need this actually. Pass that along if you would. Thank you, Mary. We did appreciate the opportunity to be able to address the questions. They're not always going to be resolved maybe the way you wanted them to be, but open, transparent communications, we will fix the things that we can fix. Some of these things that we've been asked about in the past have been state regulations, in which case we just simply share that we'd love to be able to do it, but the state won't allow us to be able to do it. Next, what I want to do is have you hear from our new Executive Director of Human Resources. If I take you back in time about 4 years ago when we did a survey, one of the concerns we had from employees was the services they were receiving for human resources. Now, at the time, we had been going through a pandemic. There had been a lot of changes that took place. There was a lot more work from home, which was not leading to our employees feeling they were able to get the communication levels they needed with HR at the time. Our new executive director is really focused on customer service. She's put an incredible number of programs together. She's working with a great team of people that are all making this happen, and you're going to hear about a lot of things from HR today. But critical to us as a university is having people that are out to support the university, to promote our mission, to train our students, to change healthcare through great research. And that's where our core values come into place. Our core values, as we've listed them in the revised strategic plan, easy to remember, ICE. And so it's about innovation, collaboration, that's us working together as a team, not in silos, and then delivering on excellence, the E. But to collaborate means you need to work with good people who are embracing what we do together, people who are not causing rifts between different areas of the university, people who are ethical, people who are moral, people like all of you. And so to do that, we need to have a plan in place that allows us to retain and to hire people that are outstanding and meet our core values. There are two things we look at when we hire people at the university. One of those is competence. Can you do the work that needs to be done? Are you trained? Do you have the experience? The other is character. Are you somebody who's going to be part of this team, who's ethical, who's moral, who's not going to create those difficulties between different work groups, who's not going to create the situation where somebody is treated poorly? And when we look at individuals who've been asked to leave the university over the last 5 to 6 years, none of them have left because of a competence issue. Everybody is competent to do their work, and it's our job, if they need to learn more, to get them the education they need to be able to do it. Everything has really come down to a character issue. So we're going to focus very hard on culture-based hiring. And Laura Good is going to now speak to you about her rollout of our culture-based hiring plan at the university. Laura?
Thank you, President Langell. Can everyone hear me okay? All right, very good. So what I have for you today to go through is our values-based hiring process. And really, President Langell explained the purpose of the plan, and really just making sure that the individuals that we're hiring, that their values align with our institutional values. And doing so brings us lots of benefits. This article here in the Forbes magazine from last year demonstrates, and you can read here, the importance of having a workplace that aligns with your personal values. And that's what we want to do here at NEOMED. So one of those benefits and how that we'll implement that and what it means for us is we're going to hire the individuals that'll model and exemplify our core values. So building a values-aligned, ethical, high-performing workforce. And how are we going to integrate that into our process? And then aligning recruitment with our long-term mission. So making sure that we have a workforce that has the capabilities, the competencies, the innovation and leadership skills to help move the institution forward into the future, and making sure that, again, that they're collaborative and that they're not going to be disruptive to the workforce, that they will help to foster the collaboration across the colleges and across the institution as a whole, and making sure that they're not just qualified, that they're deeply aligned with our institutional mission. So how are we going to do that? Well, we created a values statement. This is on our recruiting page. It's also on the HR homepage, kind of front and center, about what we are looking for in our employees and future candidates, future employees, prospective employees. And just making sure that that they are possessing those core competencies, those values that will really make sure that they persist here at the institution. So in the job planning, we are starting to implement position descriptions and job postings that the core values are integrated into them, that we're asking in our job postings, making sure that we're communicating that the successful candidate will demonstrate the commitment to our core values. And we also need to make sure that our public-facing presence is also reflective of our core values. So we have a Glassdoor account, so we need to make sure that we have an opportunity there to display our core values to the candidates, to let them know what it's like here to work here at NEOMED, why NEOMED is an excellent place to work. And we also would like to pursue an initiative where we're highlighting some faculty and staff testimonials on our HR page, is to help understand, because if you're looking for a position, you look at a job posting, you immediately go to their HR page, like what benefits do they have? What's it like to work there? So we want to have examples of what is it like to work at NEOMED, and what better way to convey that information than to have testimonials from the individuals who are working here, and serve as a kind of a recruiting tool for our candidates as well. So our values aligned job posting, the outreach, I'd mentioned that we will have that in People Admin, so our landing page where all of our jobs are hosted. This information is front and center. And we also are going to start a process, and we actually have already started a process where we're adding a value statement to a job posting. So in addition to candidates submitting their resume, their CV, or a cover letter, we've also added a values statement where they can, in under 200 words, so it's not a big, long essay that you're going to have to read as a hiring manager or a search committee, but in under 200 words, talk about what do those values mean to you personally and professionally for those candidates to submit. So you'll have kind of an inside look at those candidates and what their values and behaviors are that they will be bringing into your workforce. And then we're also going to evaluate those statements during the review process of those candidates. Does their statement strongly align with the values that NEOMED has? And if the answer is yes, they're going to continue right on through the interview process, and they'd be evaluated just as they previously would be. If the answer is no, then they will not move forward in the review process for an on-campus interview. All right, so the interview process itself. I do want to highlight here real quick for those of you who might be hiring managers or on search committees in the room, we really designed this not to feel like more work. We did our very best to integrate the existing, to integrate the core values piece into the existing process so that it doesn't become burdensome. It's not, doesn't feel overwhelming. It's not additional work. It's just becoming integrated into what you're already doing. So the structured behavioral interview questions, I think we'll have those updated and posted, I think, this week. They're kind of waiting on me, so I apologize. But we'll have those posted here shortly, and just making sure that in the interview questions that you're asked, obviously you're still asking those performance-based questions, the competency type of questions, but integrating these core values questions into the process as well. And finally, we do have also, well, there's one more thing, but next to last, we have an interview evaluation piece. So when you do have those on-campus interviews, we do or have developed a rubric that you will use to help evaluate the integrity, collaboration, and excellence that those candidates displayed during their on-campus interview. And then that will become part of the overall selection process. But finally, before you get to that final selection process, you want to make sure that you're doing reference checking. And so the reference check process has been updated in People Admin if you're using the electronic reference capability that exists within that system, or we have a paper form that you can use as well. And so those two systems, the system and the paper form, are aligned and have those existing questions that were on there, the performance-based, credential-based kind of questions, but then also adding in the values questions as well. So those will all align. Next, or finally, then we have the selection and hiring decision. So you're already using a rubric that goes over their skills and experience, and then you'll now have that values rubric that you will use as part of that decision-making as well. So that's the extent of how that core values is going to be integrated into the hiring process. So again, really designed not to feel like more work, but integrated into something that you're already doing. We do have some ongoing initiatives that I wanted to mention while I had an opportunity to do so. We are going to ask someone from leadership to provide either like a welcome video or an introduction at our new hire orientation, talking about the strategic plan, the pillars, the core values, so that individuals right as they're coming in the door are getting that information again, just kind of reiterating they've seen it through their hiring process, and now they're going to see it like live and in person on that new hire orientation. I'd also like to explore an initiative to begin having a more upfront conversation with candidates when they're here on campus to talk about culture, values, and benefits of working at NEOMED during on-campus interviews. I know currently candidates do not get a one-on-one time with HR. And so we're exploring the opportunity to find a way to do that that's not disruptive to your current processes. And this may be something that's a little bit down the road yet, but just so you know, it's something we are exploring. Next, we have something kind of fun and exciting. So we currently have our employee recognition event that's held in the spring, and we are going to implement 3 new awards: one for integrity, one for collaboration, and one for excellence. So the nominations process will begin probably later this fall. I'm looking for someone who might know, but good confirm, but later this fall, probably in November, to talk about, or for individuals to nominate anyone here on campus, well, faculty or staff, to receive those awards. And then they will be $1,500 total, so $500 each for each of those 3 core values, and will be presented during that employee recognition ceremony. So I'm really excited to implement something new and exciting for all of you, and to really highlight the amazing work that all of our employees are doing here every day. And finally, a little bit of a metrics piece, because if you've talked to me so far, you know that I love the data and want to make sure that we're making data-informed decisions. So we want to begin tracking the metrics of our new hires and that value alignment to make sure that our efforts are long-term, leading to the success that we want. So are those individuals highly engaged? Are they retaining longer than their cohorts who may not have this strong of alignment with the values? So just making sure that our efforts are productive. And I do have a question slide, but I'm going to pause here for a second because we're going to switch gears. I have two more slides that I wanted to highlight to you while I have you. So next I have the staff incentive plan updates. So how many staff do we have in the room? How many of you participate in the monthly update? Or I'm sorry, not the monthly update, the staff incentive plan. Yeah, good, very good. So these two slides here that I have next are specifically geared towards staff. So we have reimagined the staff incentive plan and we are renaming it, rebranding it, the Employee Empowered Excellence Incentive Plan. So really bringing everything together under that Employee Empowered Excellence umbrella, which is our hope to bring all of the training that we have here at the institution under that one umbrella. So the new plan aligns very closely with our strategic plan and really is focusing on employee development. So you will see, we'll have an email that'll go out a little bit later today, but you will see that the softer type of activities that were in the previous plan, such as attending this meeting, have been removed, and everything is focused on employee development because we want you to be the best version of you that you can be. And we want to invest in you to help you become that. So we have increased the incentive, like the per point incentive, from $50 to $75. So you will be able to earn up to $750 as part of the incentive program. So hopefully that is received well by all of you. We do have also a new platform that we will be revealing in October. Have contracted with LinkedIn Learning to provide training for all of you. You will have access to their entire library of learning, as well as some NEOMED specific ones that we might key up and recommend for you. Next, I have an update on the staff performance review and goals update. So how many of you liked I guess in online folks, how many of you liked the performance review process? Like hardly anyone. So guess what? I didn't like it either. So we are updating our performance review process to what we are calling periodic performance check-ins. So it will still live in Cornerstone, but please know that we have updated it quite a bit. It is much simpler. You will still have goals that you'll need to enter, but there's no more approval process back and forth with your supervisor and getting approval and sending it back to you. So it is much easier. And the performance check-in piece is really best practice to have more timely conversations with your employees, to have more of a continuous development process, more conversations about goals and goal alignment. Did this goal that was a priority for you in October, is it still a priority in December? Things change and priorities change, and we need to be agile and flexible to adjust to those things. And we also want to foster some stronger communication. We really heard from employees that there's, I guess, in the effort of transparency and communication with your managers, even if you're not having a one-on-one check-in every week, maybe you only meet once a month, but there needs to be frequency of communication. So we worked in at least once each quarter. Some departments may meet more frequently, depending on what their needs are. But we want to make sure that we're building it into a process. So those long, lengthy core competencies, forms, like values that create in August and then you don't look at until April, those are going to be gone, and everything will be a much more fluid process. And Takara's worked with me pretty closely on this process. Thank you very much. We'll be creating some training videos that will go out later this week. They're probably not going to be more than like 5 minutes because it's a very simple process to use. And then I'll go back to the questions. Does anybody have any questions, anything that I can help address? Yeah, Janet.
The awards, are you going to still keep the same employee awards, or will the 3 awards replace
Yeah, so the question was, will the existing employee awards stay in place? And the answer to that is yes. These will be an additional award to what we've already done in the past. Thank you. Yes. You might have to go to this microphone right here.
Hi, Jackie Boyle, College of Pharmacy. Thank you for sharing the new idea about the mission statement and the vision and the values and how we'll collect that for potential candidates. Is there any AI integrated into people admin, and will there be a way to tell if that response was AI generated or not? Thank you.
Yeah, thank you very much. That's a great question. And the answer to that is I'm not certain. So there may be, is for people admin itself does not generate any type of value statement, but I don't believe there's the capability for it to detect if a value statement was written by AI. But that's a very good question, maybe something that we'll need to consider. And that's probably why in that interview process, those questions are going to be so key, because you'll get a feeling for the person themselves to know if that felt authentic, what it was that was written in the value statement. Thank you. Yes. So the question was about faculty evaluations and if there's a timeline for or if those will be adjusted or what the timeline for that might look like. The answer to that is not quite yet. I know I've had several conversations about the annual performance, the APE for faculty, and you were actually on my list to talk to as someone who might have some good insight into that process. And could we convert it to an electronic format where it lives in a system rather than just a PDF form that someone would fill out? So stay tuned. We might be having some future conversations. Yes. No, so the question was about when you're reviewing the value statement, is that right? Within the search committee process, knowing if they kind of check the box, if it meets our standards or criteria. And that would be a conversation that you would have in the search committee with the search committee as a whole. Like a blueprint? Yeah, so I do not currently have any guiding document created specifically for that, but we could certainly put something together to make that an extra tool that'd be available for the search committees to review as part of their process and to have it, again, as a tool, a resource to help with that determination. Thank you for the suggestion. Good question. So when will we have access to LinkedIn Learning? Soon. So I unfortunately do not have a definite date yet. We have started the implementation timeline. We're working through the single sign-on process with LinkedIn, with our IT team. I think Todd Felmley is working pretty diligently on getting that up and running. So believe me, there will be lots of notification out to the campus once we get that set up and ready for you to start using. Yes, can you use the microphone?
Patria Kober from the College of Pharmacy. So the LinkedIn Learning, this is something that we've had questions about, even students being able to gain professionalism and different skills from this. Is this something that students will also have access to or just faculty and staff?
We are actually exploring that piece as well as part of a part 2 implementation after the first of the year for students to also have access to LinkedIn Learning. So thank you for asking.
So with the LinkedIn Learning, there'll be a single sign-on. Will that be separate from our own LinkedIn accounts that we may currently have, or will they be integrated?
Yeah, good question. So they will be independent of each other. You will be able to put any like badging or certificates that you earn on LinkedIn Learning on your personal profile, but your personal profile will not be tied to your LinkedIn Learning account. So those are all great questions. Thank you so much for asking. We will have, again, more announcements going over all of the specifics as it gets closer to our release time for that specific platform. All right, thank you so much for your time and attention. I really do appreciate it. I'm going to turn it back over to President Langell for his updates.
Thank you.
Well, this is.
Thank you, Laura. That was wonderful. And some of these really important questions, like, do we have a detection system for AI? I think we need to figure out as a university still how we totally embrace AI, because I don't want to put anybody in a position where they feel like their integrity was breached because they use it, because everybody uses AI, or at least many people do. And I would very much expect a professional who wanted to make sure they had a really good statement to write something and then run it through AI to say, did I make a mistake here? Did I get something wrong here? And that's why it's so important that we have these conversations with people in real time to ask the questions and hear them think without having them punch it into a computer. But the real key here is to tell people outside that we're really serious about values, that we're really serious about having good team members. So when you come in, this is a key piece of how we're going to evaluate you, that your CV or your resume already states that you should be competent, but are you going to be of the type of character that's going to be part of who we want to have on this team to empower you to be able to do so? The rest of the presentation today is going to be relatively short. It's mostly giving out accolades and information. We had a very lengthy State of the University last month, and I thank you for those of you who participated in hearing what we were doing and all the great work that we've done together. I'm going to go ahead past your slides. First, I did want to recognize that during our last Board of Trustees meeting, we were able to celebrate with our board the President's Excellence Award, which this year, for a Rootstown-based faculty member, went to Dr. Jesse Young. For a clinical faculty member, to Dr. Thomas Mike. And for our two staff members, we had two that were so great, we decided to give out two instead of one, Jordan Sindrich and Joanne Hayes. So congratulations to all of them, and thank you for all that you do for this university. And as I understand it, after about 40 years, Joanne said she's got no interest in retiring. So Joanne, if you're here, thank you. We're thrilled to have you and hope you stay with us for a very long time. Would also like to recognize Dr. Adrian Dan. He is one of our faculty members who practices surgery at Summa Healthcare. He has just been elected as a director at large for the American Society for Metabolic and Bariatric Surgery Board of Directors. And then one of our students, our P2, Deanna Laughlin, was selected as a delegate to the 78th World Health Assembly in Geneva, Switzerland, representing the university on a world stage. Congratulations to Deanna. And then also to Elias Asmar, who is the rising second year, or now a second-year student, who is the only one selected in the nation amongst all applicants to be able to gain a summer research fellowship at Ohio State University's Wexner Medical Center. And then very recently, we had a submission from Dr. Safadi that he was able to bring 4 of our talented students with him to the National American Society of Bone and Mineral Research meeting. And his Ph.D. student, Gabrielle Robinson, received the National Underrepresented Minority Mentorship Award. Trinity Crunk, our M.D. Ph.D. student, had a chance to present several papers, as did Michael DiSabato. And this is one I was thrilled to be able to see. Many of you know that our national representative for the medical schools, our medical school belonging to it, is the Association of American Medical Colleges. This is a national organization, and they came out with a paper that was published on the 18th of September. It was titled Robust NIH Funding Saves Lives and Strengthens America. And in it, they highlighted who they chose, 5 outstanding universities in this country who are having big impact through NIH funding. LSU, University of Kentucky, Duke University, the University of Utah, and NEOMED. And they recognized Dr. Reed for her work, her $1.9 million NIH grant, Dr. Ron Cease, also here at this university, and his director's Early Independence NIH Award, and our Ph.D., M.D. Ph.D. student, Trinity Kroc, who is obviously, many of you know, is our student trustee also at this university. Really great national press. Many people have said, well, what made them choose NEOMED? And I guess the question back to them is, well, why wouldn't they have chosen NEOMED? So we're thrilled to be an incredible company with those total of 5 individual universities. NIH has been something that's been in the press. You've heard from Dr. German about, our Vice President for Research, a lot of concerns. Is the money going to flow through? What's the federal government going to do about it? Well, we've done very well. And since our last update in May where we discussed it, we've brought in another $7.2 million in research to support the work being done by our incredible faculty members who are writing these grants. 2, I want to oh, yes, please do applaud for that. 2 of them I want to call out specially. Many of you know Dr. Jeffrey Wenstrup. He's our former chair, been at this institution, built our incredible hearing research group, and he has just been awarded $3+ million NIH grant, auditory information processing in the amygdala. And then Dr. Mohammed Ansari received a $2.6 million NIH grant on mitochondrial DNA leakage, promotes inflammation, and intervertebral disc degeneration. So they accounted for over $5 million of those $7.2 million that are coming in, but the others are all incredibly important. Do you want to recognize ones that were awards from institutions or within the state of Ohio? Dr. Bracken, Ms. Drummond, Dr. Rauda, Dr. Kazimov, Dr. Mesimore, Ms. Morgan, Dr. Rahman, Dr. Ribnick, Dr. Civic, and Ms. Zavala. And from a national level, Sean Herzengrother, Dr. Hupp, Margie Sanders, and Dr. Wu. So congratulations to all of them for having their work recognized. One of the things we talked about at the State of the University address is some of the restructuring that's taken place from our research side of the house. We have a big focus now on research. We've always had great researchers. We've taken time over the last few years to fix up the university's campus infrastructure, really focus on quality educational programming. And while our researchers have continued to thrive and we've been able to provide some more resources to them over the past few years, we're going to really increase those resources greatly this year because we are in a position to be able to do so, and it's a key part of our mission. One of the new big areas of focus for us is the Health Services Research Group. They'll be having a symposium on October 8th. I encourage any of you who are interested to attend to hear about the work that's ongoing and the work that will be growing in the future. We also started up NEOMED Healthcare about 4 years ago now, and NEOMED Healthcare has grown. In fact, we're still bringing on about 5 to 10 new patients per week. We need more help. We need more people to deliver that great care. And we're thrilled to be able to have signed on Richard Waldrop. Dr. Waldrop is an M.D. Ph.D., graduated from Ohio State University. He is board certified in internal medicine and in pediatrics, and he comes to us after having already served as the program director for internal medicine at the Cleveland Clinic, and then after that, the program director for internal medicine for community programs at university hospitals. And he currently is a distinguished national leader who is the current chairman of the American Board of Internal Medicine. He will be officially joining us November 1st. an ultra high quality physician. If you choose to get your healthcare at NEOMED Healthcare, he will be there and available for you and helping to run and grow our healthcare enterprise. Our flu clinics are being offered by our Neovations Pharmacy Consulting Group here on campus. These are the dates that are available. We do have a requirement for the flu vaccine here at this university. We have to be very careful about exposing, especially our clinical students who are going to be working with immune-compromised patients in the clinical setting. Vitals has continued to thrive. Dr. Sohan was here last time, one of our graduates. He gave an amazing Vitals presentation. Our next one will be Dr. Michael Hogue. He is the Executive Vice President and the Chief Executive Officer of the American Pharmacists Association. So offer all of you to please join us for his presentation coming up on October 2nd. And every year, our students come together and focus on a multicultural festival. For those who are new at the university, this is a great opportunity to come meet our students and hear about the cultures that represent who they are, how they define themselves, and with it, usually the opportunity to learn not just about the cultures, but the amazing food from those cultures and ethnicities, and a chance to be able to sample some of that fare. This will take place on October 9th up in the Cook Alumni Hall. I hope, again, you'll join us for that, hear and meet our students, and learn a little bit about how they define themselves from their past and their heritage. And believe it or not, the Cleveland Browns actually won a game on Sunday. A couple of Cleveland Browns fans out there, I'm not sure how they pulled it out in the last 3 minutes when they were having an absolutely terrible game, but they did. We had a pregame event on Thursday. It was incredibly well attended. Thank you for the Marcom team for doing that. Over 250 people showed up. They ran out of food. We think they've learned from that. We'll have more, but we're going to do another pregame tailgate on October 10th, and then hope that the Browns can pull it out again for the following game on Sunday. Human Resources is continuing to focus on all of our faculty and our staff. Our employees here are critical. You're the reason we do what we do, and they want to make sure they're taking care of you. So though you don't have to take advantage of it, we all know that the three biggest factors that can improve your quality of life and your quantity of life are exercise, nutrition, and sleep. And so they're focusing on elements of nutrition and on exercise right now. We can't do much about your sleep from here at the university, but they are doing a step challenge that will end on November 9th. And then the award for whoever excels at that the most will be an extra vacation day that will be given out to that individual. Fall workshops are coming, focused on Microsoft Teams, collaboration beyond calls and chats, how to utilize this resource. A wellness workshop incorporating movement into your workday, mastering crucial conversations, and fundamentals for leaders. They're also having a nature walk, exercise and weight loss tools for success. Dessert with the Dean is a brand new opportunity for you to come and enjoy some good food and meet individually with our deans to tell you about their colleges and the work that they're doing. The first dean to step forward to do this is Dr. Julie Altman. So please take the time, if you have it, to come meet with Dr. Altman on October 2nd and enjoy some dessert at the same time. A walk and talk is a walk around the campus. I'm going to get out there and help lead that. We'd encourage everybody to do it, and it's your chance as we're walking the campus to come up, talk to each other, ask questions, get to learn a little bit more about each other. If Dr. Welton comes out there, you can get some free psychiatry advice from him. But it's a chance for us to get out, stay healthy, and to communicate. Celebrate with fall with donuts and cider at the RGE building, and then open enrollments benefits fair, which reminds me to say, once again, we are working very closely with Oswald Company on our healthcare benefits. We know they're going up once again. And the reason for that is our cost of care exceeds the amount of money we're paying the insurance company. So even though we did just go up, and it's been going up year over year, it's a trend nationally. We expect it to continue to happen. We're working hard to try and keep those as low as possible, but we do know it's going to go up again. Many times, the amount of money we're paying the insurance company is substantially lower than the amount they are spending to keep us insured. In fact, the ratio is often about 1.3, meaning they spend $1.3 for every dollar we give them. And when that happens, they say, well, we got to bump you up and learn from it. And so we're expecting something again this year. We'll keep you informed. We don't know who that's going to be yet. We are working with AltCare, but we will be having the open enrollment benefit fair coming up, so we will know by then, and we'll be able to give you all the information on it. And that is all that I have. Are there any questions that I can answer for you today? No? Well, Laura, thank you for an incredible job, and thank you, all of you, for your engagement and for attending.